Yeah, the key components of an integrative approach to the treatment of RA are really found in the title of the manuscript. And when the authors came together to consider how to organize this guideline, they truly did look at exercise, rehabilitation, diet, and then other integrative, treatments. And so those are really the buckets that we determined, when bringing this together. Trying to organize in a way that would help us in the literature search, but also assist in the application, as we think about applying this and offering this to patients, for their unique RA experiences. Well, thank you for that question, because that is absolutely vital and key for this guideline. This, working together in parallel with the pharmacologic guidelines as they relate to RA. In the early creation of this guideline, we established guiding principles to help us as we think about these guidelines being developed. And certainly one of the guiding principles is that we parallel these integrative RA treatments with the pharmacologic treatments for RA as well. The two do not independently exist, and one can't be applied really without the other. So they interweave, they come together. When we meet patients, when we serve patients, when we're considering what's the best way to move forward for treatment of rheumatoid arthritis, we must think about both the pharmacologic and integrative approach for most optimal patient outcomes. Yeah, they certainly do. Every patient's experience, with RA, which really in that sense is a very heterogeneous condition, we must apply, the best evidence, for the patient, and the best, clinical expertise, which is available, but patient preference in this as well. A person's experience with rheumatoid arthritis is varied. It's different. And when we think about this whole, quiver of opportunities that we have with treatment, that helps us to make the decisions, that are best for the patient. When we think about early disease, maybe later disease, active disease versus controlled disease at target, all those things come into play when selecting and choosing, which of these integrative approaches to use. There's an appetite that patients have generally for being aware of and knowing about and selecting and choosing to use these integrative approaches. Through this process of guideline development, which included patient input with a patient panel and then patients serving on the voting panel with decision about these guidelines, one of the things through this whole process that I was really impressed with, and this really sticks with me in clinical practice today, is the fact that patients want to know early on what these options are, these integrative options are for treatment. And then they desire guidance to know when to use the integrative treatments and how to use these integrative treatments for RA. And so I think there's a high desire for these things to be known and guidance to be received through expert clinicians to help them know when and then how to use these treatments, which really brings to discussion the interprofessional approach that's needed as well. Yeah, really a great question also. The interprofessional team is absolutely vital in this. Certainly rheumatologists, PAs and nurse practitioners who work in rheumatology are absolutely tremendously important. For the pharmacologic aspects that we discussed earlier, pharmacists can play a tremendous role. When we think about, exercise, rehabilitative approaches, of course, comes to our mind, physical therapists and occupational therapists. Diet, dietitians are tremendously important. From a psychosocial aspect, psychologists and others, we could just continue on with this. The point is, each of these interprofessionals has expertise that can help in the guidance, again, in most optimal outcomes for patients with RA. Again, I think the comprehensiveness of what the integrative guidelines are should be noted. We note this in the title with each of these buckets or domains which were considered. I think there's a tremendous opportunity for further investigation, for further research into these conditions. Much of the evidence was of low certainty. A few of the PICOs, the questions that we asked, really had no evidence per the inclusion guidelines that we considered. This is a first for the ACR, the American College of Rheumatology, and there are efforts to continue to watch this literature and receive these data and continue in this evolving their approach to RA treatment as well. So I think being a first, it means there'll be second and others. And preparing for that, I think, is the tremendous opportunity that we have.